To start out with, I want to say a word of thanks to the people who responded to my request for support recently. Thank you all so much. And thank you to all my subscribers here. We just topped 50,000 subs, which I really appreciate and feel great about. And now for today's talk. As the regulars here know, I occasionally address men's physical health as a topic, and sometimes, as I have with my diabetes, I use my own medical issues and how I'm dealing with them as a part of the material. As men age, as it turns out, their bodies get better and better at providing that material all the time. My body hasn't been an exception. Sometimes that results in difficulties, and sometimes it results in difficulties that are downright funny, only not when they're happening. Combine that with the unfortunate state of medicine for men and the more unfortunate state of medicine provided by the Veterans Administration, and you can get a dark comedy, hysterically funny in a rip-your-dick-out-by-the-roots sort of way. And that is the story I'm here to tell you today, which comes with a trigger warning. If you have a penis, you might laugh at what I'm about to tell you, but it will be a nervous, edgy kind of laughter. I just wanted to say that so I could say I told you so. Now on to the topic, BPH, or benign prostatic hyperplasia. It's a condition that will affect most men who live long enough. Half the men in their 60s, my age group, will have some symptoms of it. That percentage jumps to 90% or more as men go into their 70s and 80s. Simply put, BPH is an enlargement of the prostate, a gland roughly the size and shape of a walnut that, as you can see in this graphic, sits underneath your bladder and wraps around your urethra before it reaches the root of your patriarchal staff of glory. It is surrounded by a containing membrane, so when it swells, it pushes in on the urethra on all sides like a clamp, restricting the flow of urine through your manpipe, sometimes turning it into a slow-dripping faucet. It can, untreated, pinch the urethra closed, turning off the spigot completely. I started to notice a slight reduction in water pressure in my previously robust fire hose a couple of years ago. I knew that this was a common part of aging and I didn't think much about it. However, in the past few months, my flow got progressively weaker. It got so bad that taking a whiz became taking a dribble, leaving me unable to write my name in the snow with my tallywhacker. Not that there's any snow in September in Virginia, but you get my point. I got a prescription for a drug called Tambulosin, which helps open up the waterworks a little, but it only worked for a little while. Then, recently, I got a urinary tract infection, which if you've ever had one, you know it feels like you're pissing out fish hooks. It sometimes happens in those with BPH because the bladder doesn't fully empty. And since the infection leaves you needing to piss every 5 minutes, every time there is the slightest pressure on the bladder, it's like you're pissing out fish hooks all day, every day. Now, I know there's a number of feminists and more than a few cucks out there whose sentiments about yours truly lend them to seeing humor in the idea of pain in my pecker. But that's not the funniest part of my story. And as you're about to learn, it's not even nearly the most painful part. As you might imagine, by this point I'd grown just a little frustrated with the kink in my garden hose, and lacking any other options, I sucked it up and headed over to the VA clinic. I saw a PA there, a physician's assistant, not a doctor, which is standard procedure for the VA. I was given antibiotics and a referral to see a urologist a week later. Only it didn't turn out to be a urologist. It was another PA. Apparently, when they refer you to a specialist at the VA, they still aren't sending you to a real doctor. The system is geared to have a bunch of PAs sending patients back and forth to each other in a loop that keeps actual doctors pretty much out of the picture and, importantly, out of the budget. And mind you, the people at the VA I go to are a great bunch of people, good as gold. The system they work for is the problem, not the people in it. But that's another talk for another day. Anyway, the pseudo-urologist PA I ended up seeing was a perfectly affable chap I'll call Howard. Howard did his due diligence, made some small talk, did a sonic check of my bladder, and inserted his index finger up my middle-aged white ass to examine the prostate. He noted, as he was poking and prodding, that it did not feel particularly enlarged, but that the symptoms I had were the deal-breaker on the diagnosis. He also pointed out that we were still in a bit of the dark ages on this part of male physiology, which made perfect sense to me while his finger was wiggling around up my ass. He said that there was still much we didn't understand about male plumbing, to which I pointed out that perhaps if we had breast cancer-level funding for men's health issues, that we might be in better shape. Affable Howard, for the first moment in my time with him, seemed slightly less than the gregarious man I met when I walked in. I could see him struggling with what I said, trying in vain to figure out how it couldn't be true. Finally, he conjured up the wherewithal to say that he was sure men's health issues were covered since men held all the purse strings. He was nodding his head while he said it. It was as though if he could get me to nod in agreement, what he said would be true. I asked him if he thought men holding the purse strings really meant that the money was spent on men. And before he had the chance to say something even more stupid, I politely pointed out that between the two men at the room at the time, that I was the one with the expertise on that subject. He was a good bit less conversational after that, but he still had a friendly smile. Returning to the business at hand, he got very businesslike as he summed up my visit. I had BPH, it was advanced, and I needed treatment. Treatment consists of a possible intervention with 2 drugs, both of which cause sexual impotence and possibly prostate cancer itself, and surgical interventions which can also cause impotence and always result in something called retrograde ejaculation, at least for those who can still get an erection after the surgery. The details of retrograde ejaculation are too gross for me to even go into here. I trust those who want the details will consult Google, but not right after eating. At any rate, after the exam and some consideration, Howard decided that I actually did need to see an actual bona fide urologist, the kind with a degree in medicine and specialty training. They were able to schedule an appointment for me to see one. It'll be May of next year, they told me. Let me just say that I didn't consider my day to be going very well at this point. I was pissing fire, 1 drop at a time. My plumbing was stopped up and getting worse, seemingly by the hour. I knew I wasn't going to make it till next Friday, much less 6 months before push came to shove. Luckily, President Trump had refunded the Veterans Choice Program with about $2 billion. That program allows veterans who have to wait more than 30 days to be seen about a problem to seek help from a civilian doctor. This happened Friday afternoon, so I settled in on the idea that I would have to wait over the weekend to get the ball rolling, and hope the waterworks didn't shut off completely in the meantime. I even took the opportunity to do some reading and found that acupuncture had shown some promising results with BPH and had resolved to pursue that after the weekend. I've linked to some info on that for those interested, by the way. Then came the trip to the bathroom I will never forget. As I had 10 or 15 times earlier in that day, I took the dreadful walk to the toilet, preparing for the slow, painful relief of pressure on my bladder. This time, it was slower and more painful than usual. As I had so many times before, I used the force of my abdominal muscles to bear down on my bladder, trying to increase the pathetic dribble coming out of my pecker to something resembling a stream. Suddenly, there was a pain for which this seasoned wordsmith has no power to describe. It felt like a badger had clawed its way into my bladder through my balls and was trying to claw its way out through my dick. My dick, as though totally independent of my body and mind, suddenly stood at half attention and began undulating like Linda Blair in The Exorcist, or like a fish dropped by the edge of a stream just out of the water. It was doing this bizarre dance as the badger clawed harder and harder, and suddenly there was this grotesque pop, like a bottle of champagne at a victory celebration. Now, I was dancing all right, but it wasn't a victory dance. And as I heard that pop, I caught something out of the corner of my eye. It was a dark object that shot down and hit the rim of the toilet, ricocheted off the porcelain with a metallic clink, and up into the air. It hung there for what seemed like an impossibly long time before dropping directly down into the water. The next thing I know, my pecker has quit dribbling urine and is now dribbling blood. It's hanging there like a Walking Dead extra, throbbing and dripping straight down into the toilet, painting the sides of the bowl with crimson streaks. Now, the first cogent thought I remember having about then was, what the ever-loving fuck just happened? I looked down at my junk again, and it was still dripping blood, seemingly at a faster rate than my urine had come out. It seemed, in this particularly surreal moment, to be trying to communicate with me, as if to say, "Paul, how did we get here?" I grabbed a wad of toilet paper and covered the head of my bloody dick, squeezing off the flow of blood like a battlefield medic. I tried to turn away from the toilet without having any real particular reason to do that I can remember. Still having a death grip on my bleeding tool, I turned one way, then the other, but was trapped by my pants, which were now down around my ankles like leg irons. I was looking for somewhere, anywhere to go, and feeling trapped. The scene I was in at the moment, that of me standing there with my bloody dick in my hand, twisting around like a 4-year-old who had to piss real bad, was just too wrong, and I wanted out. Finally, I regained some of my composure. I grabbed the toilet cleaning brush with my free hand and, still clutching my wounded Johnson, with my bare, recently violated by Howard the affable PA ass, twisting in the air, began fishing around in the bowl for that champagne cork, or whatever that thing was that had busted out of my pee-pee like a scene from Alien. As you probably have guessed, it was a kidney stone. Only it wasn't just any kidney stone. It was big. Really big. I know as far as real stones go, it wasn't that big at all. But as far as stones that you push until they rip through your urethra go, it was gargantuan. Take a look at the image here and ask your penis what it thinks. It will tell you that size matters a great deal. After the shock and disgust of the moment started fading away, it occurred to me that this was a time of hope. I had no idea at all that the stone was in my bladder. Nice, affable Howard with the wiggling finger never mentioned it as a possibility. He pointed me toward a surgery that might have happened sometime in 2018. A surgery that most likely would have wrecked me sexually. A surgery that I didn't need. Immediately after that bathroom trip from hell, I downed what was left of a cup of coffee I had, then proceeded to guzzle water, my hopes renewed. 30 minutes later, I was pissing like I was 20. Like there were no symptoms at all of BPH. I know, all's well that ends well. It's a nice little chirpy tagline to this story along the lines that any airplane landing you walk away from is a good landing, and that what doesn't kill you makes you stronger. I am sure there is some sort of platitudinous lesson here, but I'm happy to say I won't take the time to manufacture the cliché required to end things on a note like that. What I will say is, gents, take charge of your medical care as much as possible. Take nothing for granted. And oh yeah, if you think you have symptoms of BPH, make sure that's actually what you have. Doing anything else can land you in a comic tragedy with you and your little head in the leading role. Not the best place to be, if you want my opinion. And that is it for another talk. As always, I do hope you've enjoyed, and we'll see you next time.